We're getting to see the perspective from the local front line. We're hearing from a nurse who has spent months fighting the pandemic.
Fox 12's Drew Reeves shares her story.
Hannah Doherty is a nurse at OHSU and has been on the front lines of this pandemic ever since it began. She says her unit was converted into a COVID-19 wing in the ICU, and she's been working with COVID patients ever since. Doherty says it's been a difficult adjustment to their new normal. She says for a while, no one knew what to expect working with COVID-19 patients. She says it was scary coming to work for a little bit, but now most doctors and nurses know what lies ahead at work. But that doesn't make it easier. She says she's never seen a single virus cause so many complications in patients. A portion of them, she says, don't even have underlying conditions. Doherty says many times by the time COVID-19 patients make it to the ICU, they're already intubated and won't even know they have the virus. She says it's breaking the news to their families that is the difficult part. And with cases increasing in Oregon, she says it's important that people don't just look at the mortality rate and listen to health officials.
It's just really important to remember the human as a whole and like what brings us joy and positivity and quality in our lives. And COVID-19 affects a lot of that beyond just life or death. And it's really worth it to do these simple practices to help keep that quality in every area that we can.
Doherty said that some patients recover from COVID-19, but also some never do. She says she also can't imagine when or if things will ever get back to normal. Doherty says that she thinks it's important that people keep up with the ever-changing information regarding COVID-19 and to wear a mask and practice social distancing. Reporting downtown, Drew Reeves, Fox 12 Oregon.